Hey everyone, we're going to go ahead and get started about 3 minutes from now. If you can, we're just doing a sound check to make sure that the audio is working. If you could hear me and you're on a computer, if you could type into the sidebar that you can hear me, that would be great so we know that the audio is working. Thank you so much. Hey everyone, we're going to go ahead and get started. Welcome to the webinar on Bringing It Home, our dollars, jobs, and healthcare. We're really glad to have you guys all on the webinar today. My name is Kyla Franks. I'm the field director here at the Tennessee Justice Center. I'm here with Gordon Bonnyman, staff attorney and founder of TJC. He'll be talking more today also about why it's time to bring it home. So this webinar is going to be 1 hour long. And we're going to answer questions at the end of the webinar. If you're on a computer, you'll see on the side there's a panel. You can type your questions into the question box on the panel at any point, but we'll wait till the end of the webinar until we answer those questions. And just so you guys all know, we're recording this webinar today, so we'll send out the recording to everyone after the webinar, and also the PowerPoint presentation as well. So you all will receive that, and everyone who registered for the webinar will receive that as well. So just to introduce, for anyone who is unfamiliar, the Tennessee Justice Center is located in Nashville, Tennessee. We do several things. We help clients one-on-one with problems that they're facing. We're obtaining public health insurance benefits that they're eligible for. We provide trainings on how to ensure that people get the basic safety net items that they need, nutrition, healthcare, and we also advocate for Tennesseans. TJC is working to make sure that this is a Tennessee in which everyone thrives. And just so you all know, we are a nonpartisan, nonprofit organization. So what we're talking about today is only about issues related to healthcare coverage and not party politics. So what is the Bring It Home campaign? The Bring It Home campaign is a campaign so that we can bring home our federal tax dollars back to Tennessee, so we can bring jobs back to Tennessee, and so that we can bring healthcare back to Tennessee. This is a nonpartisan campaign, an effort in which organizations and individuals are educating Tennesseans and policymakers about the need to make full use of federal Medicaid dollars to address our most urgent and pressing healthcare needs. We need to put Tennesseans' own tax dollars to good use here in Tennessee, and that's the goal of the Bring It Home campaign. So what we're going to cover today in this webinar is just a basic background in case anyone needs to learn more about what is Medicaid. What does Medicaid do for the state of Tennessee? It's called TennCare here in Tennessee, and so that's why we put those together. We're also going to talk about the potential for Medicaid expansion here in Tennessee, for bringing home those federal Medicaid dollars to address our most urgent healthcare needs. We'll go through a little bit of the history of the political environment, what's happened so far, what's happening now, and the case for expansion. What would bringing back our federal Medicaid dollars of $1.4 billion a year mean for Tennessee, and how would it help Tennesseans to thrive? And then finally, we'll go through a little bit more about the path forward. What are we looking at now? What's the potential? What can we do to make sure that Tennessee is a place where everyone can thrive and have the access to health care that they need? So that's our agenda for today. And as I mentioned, if you have any questions as we go through this, and you're on a computer, just type them into the question box at the side, and we'll be happy to get to those at the end. So with that, I'm going to now turn it over to Gordon to go through a little bit more and get us started.
Thank you, Kyla, and again, thanks to everybody who's joined this call, this webinar. We are really excited about the prospects for the state taking an action that will enable us to join the ranks of the majority of our fellow states, advance the quality of life for all Tennesseans. And this is an opportunity that doesn't come very, very often. We want to make the most of it. So first, as Kyla was saying, we're going to give you a little bit of background about Medicaid. I'm sure that many people on this webinar already have these facts, so we'll be brief, but generally Medicaid is not well understood across the country, and we just want to make sure everybody has a baseline of information. Medicaid is basically the nation's safety net, and it's certainly Tennessee's safety net. It is the largest insurer, health insurer in the United States, larger than Medicare and larger than any single private insurance plan. It covers vulnerable people primarily, but it also covers a lot of healthy people, notably children, providing a lot of primary care and prevention. It's a federal-state partnership. Most of the money comes from federal taxes appropriated by Congress, but it's administered by the states. The states have a great deal of autonomy and ability to shape the program according to the state's priorities. And the saying goes that if you've seen one Medicaid program, you've seen one Medicaid program, because they are so variable. And that's important to know, because it means that the state has a great deal of freedom to shape its policies as our elected officials deem best. And so this is really an issue where what happens in Tennessee is vastly, really more important than what's going on in Washington right now. Currently, there are about 1.5 million people out of our state population, about 6.5 million people who are enrolled. So somewhere between 1 in 5 and 1 in 4 Tennesseans is enrolled in TennCare, which, as Kyla said, is what we call Medicaid. The majority of the funding is federal, but the state puts up matching money, and we'll talk a little bit more about that later in the context of expansion. Medicaid, or TennCare, covers half of all Tennessee children, and it covers half of the babies born in Tennessee. And that's very important, because that's such a huge role that TennCare funding really sustains the state's network of neonatal intensive care units and obstetrical services that are there for all high-risk pregnancies. So it's one of many examples where TennCare, although focused on lower-income children and lower-income babies and their mothers, it plays such a big role that it actually supports the infrastructure on which everybody relies. Another example is that it covers 2/3 of the long-term care for frail older adults. By that is meant nursing home care and in-home services for people who are frail, mostly adults with very severe disabilities or seniors. It's $1 in every 5, actually a little bit more than that, nearly a quarter of every dollar spent in the state budget appropriated by the General Assembly is federal Medicaid match. It is by far the largest source of federal funding in the state budget, and it plays an enormous role, therefore, not only in funding health services in the state, but by freeing up state dollars for things like higher education, K through 12, public safety, et cetera. So it plays a very large, and the federal dollars play a very large and important role in our state budget. And it is also, as we will discuss a little bit more, the foundation of rural health. The data shows that rural counties' populations are much more heavily reliant on Medicaid than our cities, and that therefore, by funding coverage for rural Tennesseans, Medicaid or TennCare also funds the healthcare system in the communities where they live, and that helps sustain healthcare infrastructure that entire rural communities are very much reliant on. So Medicaid already plays a very significant role. So what is Medicaid expansion? As Kyla was saying, it's about dollars, it's about jobs, it's about healthcare. And it's option for the state to expand coverage to people who are now uninsured and who would be eligible for TennCare coverage. And with that would come dollars into the state economy, dollars into the healthcare infrastructure, funding that would stimulate the creation of jobs, and of course it would provide coverage for a lot of families that are now uninsured. Why haven't we expanded Medicaid before? And for you to know, 31 other states in the District of Columbia have, including neighbors such as Arkansas and Kentucky. But the reason why we haven't is that it was initially authorized as part of the Affordable Care Act in 2010. And then in 2014, the U.S. Supreme Court said that the expansion of Medicaid would basically be up to individual states to decide. The majority of states, including many states with Republican majorities in governing their state houses or they're holding the governor's seat, opted to expand coverage, but we did not. In 2014, when Medicaid expansion was scheduled to occur, then Representative Jeremy Durham, who subsequently was ejected from the legislature for misconduct, proposed and got passed a law that prohibited Governor Haslam from expanding Medicaid without the legislature's permission. And in fact, it applies to not only Governor Haslam, but his successors in office. The following year in 2015, Governor Haslam came forward with a proposal to use the federal Medicaid expansion dollars to extend coverage to between 280 and 300,000 working Tennesseans that are currently without coverage. And I'm going to take just a moment to describe who we're talking about and why it is so important that these families receive coverage. But suffice it to say, at this point, just to note that the governor was very concerned about the welfare, the financial security of those families, and came forward with a proposal that he called Insure Tennessee, There was a special session of the legislature in 2015 because, again, under Durham's law, he could not proceed to implement his proposal without legislative approval. And unfortunately, the legislature rejected that proposal, even though polling showed that a substantial majority of Tennesseans across party lines supported it. I think the reason why that occurred, incidentally, was that the announcement of the special session occurred only a matter of weeks beforehand. I think that the governor and supporters assumed that because of the polling that it was popular, that it was well received, that the legislature would receive it and approve in an approving way and vote favorably. Unfortunately, that didn't happen. There was an enormous backlash against the legislature, a lot of editorials, a lot of public sentiment, anger that the legislature had blocked Governor Haslam's plan, which, as I say, was a conservative alternative to straightforward Medicaid expansion, as opposed to just signing more people up for TennCare. It would have created the option for people to either go into TennCare or to use the Medicaid funding to buy into their employer's insurance plan. And it included some unique Tennessee provisions that the governor had proposed that would distinguish it from regular Medicaid. But it used the federal funding. The funding was 90% federal money, and that's what it's important to understand. Whenever we're talking about Medicaid expansion, we're talking about 90% federal money. The remaining 10% would be covered by an assessment paid by hospitals, and the hospital industry had assured the legislature in 2015, when Insure Tennessee was up for deliberation, that the hospitals would willingly pay an increased assessment, in effect a tax, in order to enable expansion to be free to the state. It would not add a dime to individual Tennesseans' taxes. Again, unfortunately, that was defeated. And as I say, it was met with a lot of disappointment and indignation across the state. Businesses had supported it. Healthcare providers had supported it. The public had supported it. And there was a great deal of pressure on the legislature to come forward with their own plan. And so in 2016, then Speaker Beth Harwell, Speaker of the House of Representatives, appointed a task force of state lawmakers to come up with their own plan. It was called the Three-Star Healthy Task Force. And in the summer 2 years ago, that task force, chaired by Representative Cameron Sexton of Crossville, did come forward with a plan that proposed a Medicaid expansion. It would not be Insure Tennessee, but it would be a Medicaid expansion with priority given the first year to covering the 24,000 uninsured veterans that would be eligible, and also giving priority to people with behavioral health problems. That includes people with addictions as well as people with mental illness. Those people would qualify in the first year. There would be an assessment, and if the governor certified that it had gone well and had met certain requirements, that then it would automatically be expanded to the remainder of the people who would be normally covered by Medicaid expansion. And unfortunately, although that was proposed in 2016, last year in 2017, the legislature, there was, and in 2018, the legislative session that just ended, there had been a lack of willingness to move forward to act on the three-star proposal. There were various reasons advanced, certainly in 2017 after President Trump had taken office, and there was a concerted push to repeal the Affordable Care Act and to restructure Medicaid. There was understandably a good bit of feeling like we need to wait and see what's going to happen in Washington. We don't want the rug pulled out from under us. But probably, as everybody knows, the Affordable Care Act was not repealed. It now commands the support of a majority of Americans. It's certainly not going to be repealed this year, and it looks like it's going to be with us for a while. And with that in mind, in April, at a closed-door meeting with legislative leaders, Governor Haslam again floated the idea, because it's clearly been weighing on his mind as he looks at his last year in office. It's the main disappointment. He has made clear that he was not able to expand coverage to the working poor, and he has made clear that he remains supportive of that. Unfortunately, the legislative leaders discouraged the idea, and so nothing happened in 2018. But it's still very much on the minds of a number of lawmakers, and certainly of Governor Haslam, and certainly on the minds of many Tennesseans. So where are we now? And what is different from 2014, when Durham's law was passed, 2015, when Insure Tennessee was defeated, and the past 2 years since 2016, when nothing really has happened? First, I think we now know that given the failed efforts last year in Congress, the Affordable Care is, as House Speaker Paul Ryan said, the law of the land for the foreseeable future. We now know, and the data has only gotten stronger, that Tennessee stands to benefit greatly from expansion. All the arguments that Governor Haslam advanced in 2015 and that the business community in the state put forward and healthcare providers pointed to 2 years ago, we've now got, 3 years ago, we've now got years of experience and research on the expansion that occurred in 31 other states plus the District of Columbia. And the data is overwhelming in showing that states that have expanded have done better according to a number of measures, and that states like Tennessee that refuse to expand, unfortunately, are being left behind. We also know the tides are turning. Healthcare has been identified in a Vanderbilt University poll that was conducted statewide of likely voters back in February, that healthcare was identified as a top voter concern, ranking with jobs and education as among the issues most on the minds of Tennesseans. And when that's broken down farther, of particular concern to something like 80% of respondents to that poll were particularly concerned about rural health and the impact of hospital closings, and they were concerned about the danger of losing coverage for pre-existing conditions and rising healthcare costs overall, all of which are influenced by the decision whether we expand Medicaid and use the dollars or not. More recently, last month, a poll conducted by Mason-Dixon Polling, a respected impartial polling firm in Atlanta, showed that 63% of likely voters support Medicaid expansion in Tennessee. And then the third, I think, important factor that shows that tides are turning is that it's increasingly understood that there are broad benefits to be realized from expanding coverage in terms of tying coverage, expanded coverage, to practical problems that are really affecting all of us. Much to his credit, Governor Haslam, when he introduced Insure Tennessee, made clear that he had a particular concern about the plight of families struggling without insurance, what that means for their financial security, for their health, for their ability to get timely preventive care. And he really emphasized that. I think that still is obviously very important, but now the data from other states and the data from Tennessee shows that we are not talking just about the 300,000 people who are in the coverage gap, which I'll explain in a moment who they are, but we're really talking about benefits to all Tennesseans, addressing some of the most pressing concerns that we share regarding healthcare. Medicaid expansion which is currently blocked by Durham's law, which bars governors from expanding Medicaid without the legislature's approval, has created a number of problems. And this includes jobs foregone. The University of Tennessee Center for Business and Economic Research at UTK did an estimate back when Insure Tennessee was proposed that using the federal dollars for Medicaid expansion would create 15,000 new jobs across the state in all 95 counties, not just in healthcare, but because those dollars circulate through the economy in additional payroll, they get recycled and they generate jobs in local hospitality and restaurants and grocery stores, wherever those jobs are created. Those salaries promote more jobs, more economic growth throughout the economy. The other thing that Durham's law has done is that it has placed more jobs, existing jobs. Not only are we not getting jobs that would have been generated through that $1.4 billion a year that would have been brought into the state through the Medicaid expansion, but the lack of those funds have put existing jobs at threat, specifically in the hospital industry, but not exclusively to the hospital industry. But using public data, the Tennessee Justice Center has looked at the financial health of hospitals, and although many large hospital systems are quite profitable and secure, there are many hospitals, over 24 in the state, primarily in rural areas, that have been losing money and are really very financially precarious. And together, they employ 13,500 people. So we are looking, if you look at the number of jobs that we could be getting, 15,000 new jobs, and the number of jobs that are at risk, another 13,500, we're talking about something approaching 30,000 jobs. And as I want to make clear, although the hospital data is the clearest, the lack of this money that could be there has an effect on the entire healthcare infrastructure, again, particularly in rural areas. So we're talking about pharmacies, we're talking about clinics, we're talking about private doctors' offices, home health systems. So we're talking about a lot of jobs. We also know that healthcare expenses have risen more rapidly in states that have refused to expand. A federal study showed that in Tennessee and other non-expansion states, premiums for private insurance purchased on the insurance marketplace known as healthcare.gov have increased by 9 percentage points higher than in the states that have accepted the federal money. And you might ask, why would that be? Well, it's because when people who are uninsured have serious injuries or a heart attack and they're rushed to the hospital, those expenses they can't afford to pay. Now, sadly, many of them are bankrupted as they try to pay, but they don't. Healthcare is too expensive to be able to afford without insurance. And so the parts of their bills that are left unpaid have to be made up somewhere, so those costs get shifted to the bills of private patients, privately insured patients, and get passed on in the form of higher insurance premiums. So the data is specific to marketplace healthcare.gov plans, but the problem of health cost shifting affects employer insurance as well. So if you're not using the federal money to pay for what would otherwise be uncompensated care, that's going to show up on private insurers' bills and increase premiums and cost sharing for those of us who are insured. One estimate done several years ago was that amounts to nationally about $1,000 of the annual cost of health coverage per capita is in the form of uncompensated care that gets passed along. So this is about healthcare expenses that we all have. And by extension, it's also about pre-existing conditions, because those pressures of uncompensated care pressure commercial insurers to either restrict their coverage of higher cost patients or restrict what they pay for in ways that particularly affect people with pre-existing conditions. As I indicated earlier, Durham's law has a particularly serious effect on rural health through depriving hospitals, clinics, local pharmacies, and other healthcare resources in rural communities, EMS services, emergency medical services. All of those are impacted because we are not drawing down the federal dollars. And then it's important to know in the opioid crisis that is much on everyone's minds, we now know that overdoses kill more people annually than automobile accidents or other injuries, accidental injuries. And what people perhaps are not aware of is that Medicaid is by far the largest purchaser of prevention and treatment of addiction, and that we are not making maximum use of that in the midst of a crisis that is taking so many lives and in blighting so many other lives. It is really a tragedy. The other thing that's changed is that the old arguments that were rolled out in support of Durham's law and at the time that Governor Haslam's Insure Tennessee plan was rejected just don't hold water, and we now have enough experience to know that. One of the most the argument that we heard the most strongly and loudly in 2014 and 2015 was that Medicaid expansion was authorized by the Affordable Care Act, or Obamacare as it's known, and that we shouldn't have anything to do with it because it was a program of the Obama administration. Well, I think everybody knows President Obama left the building a couple of years ago. We have a new President Trump, actually not so much new anymore. This administration has put its own stamp on Medicaid, its own stamp on Medicaid expansion. It's now granting waivers to non-expansion states to allow them to do some of the things that Insure Tennessee and the three-star Healthy Task Force would have done. So we're no longer talking about an Obama program. We're talking about a Trump administration with a whole new cast on Medicaid and on health policy. Second thing is the second loudest argument was that we don't want to expand Medicaid when it's likely that the Affordable Care Act is going to be repealed. Well, that didn't happen last year. It's certainly not going to happen this year, and it's not likely to happen in the future, as many even of the Affordable Care Act's most ardent opponents now concede that. And so it's the law of the land. Every day that goes by is $3.8 million of money that has been earmarked for Tennessee that we could be using that's not staying in our state. It's our federal tax dollars. And waiting for the repeal of the law is a very costly way to proceed, and I think that's now increasingly understood. Some of the other things that were argued against it was that it would have a bad effect on the healthcare system, that if you gave people who are uninsured the ability to pay for their care, that they would crowd out other people that already had insurance. Well, we know, particularly in rural areas, that the effect is the opposite, that it sustains the healthcare infrastructure, it provides revenues, it puts money into a healthcare system that we all use. It's not a zero-sum game, it's actually a win-win deal for everybody. The fiscal effects are positive. If you have a state such as Tennessee, where the hospitalization industry has been willing to cover the state share of the cost so that it costs nothing to the state, it actually drives up state revenues through insurance premium taxes, that is, insurance taxes paid by HMOs. It also goes into the economy, as I was saying earlier, that generates sales tax revenues for local government as well as state government. So it has a net positive effect on the budget. in contrast to some of the claims that were made years ago that it would break the budget. Far from it. It actually generates additional revenues. The state comes out ahead, local government comes out ahead, and some people point to the experience with TennCare a decade ago when TennCare was described as threatening the state budget, and then Governor Bredesen cut the TennCare program seriously. The difference is that at that point, we were talking about a federal share that was only 65% of the cost, and the state had to make up the other 35%. Now we're talking about the feds picking up 90%, and again, these are our Tennesseans federal tax dollars that are going to Washington, would cover 90% of it, and the remaining 10% would be covered by hospitals. So it has no negative drain on the state budget, only a positive impact in terms of additional tax revenues. And then the final thing, and this is the issue that we continue to hear about because it's being talked about now by some candidates for public office, which is that we want to hold out for a block grant. We prefer to get the Medicaid expansion money as a blank check, one large chunk of money that the state can then decide how to spend as it sees fit, unencumbered by any kind of federal restrictions. There are pros and cons of that. We can debate whether that's a good idea or not. I would note that as a consumer advocate that there are important protections in those federal rules that protect mothers, children, frail seniors, for example. The whole regulatory apparatus for ensuring the quality and safety of nursing home care is wrapped up in federal laws that would be gone or not applicable if we simply got a block grant. Having said that, reasonable people can disagree whether the advantages of a block grant in terms of increased flexibility outweigh the costs in terms of consumer protections and government accountability. Truth to tell, that's neither here nor there. That's really an academic discussion. It's a moot point because as a result of what happened in Congress last year, block grants are off the table. So if policymakers at the state level are saying we want to hold out for a block grant, we don't object to asking the federal government, the Trump administration, for a block grant. But I can tell you right now, and the Trump administration has been telling other states as recently as Kansas a couple of weeks ago, that it's not going to give states the ability to just take the money and do with it as they please. They still have to meet the requirements of federal law. The Trump administration will be generous in granting waivers, but the idea of a block grant of we'll take the money and thank you very much, that's off the table. And it's important to understand that because if we hold out for block grants, we will continue to lose $3.8 million a day, $1.4 billion a year. It's another way of saying no to bringing the dollars home. Whether that's intended or inadvertent, that's the effect. So let's talk a little bit more about the benefits of bringing home the dollars. And we're framing this as bringing it home because it's important to understand, these are federal dollars. The fact that we are a non-expansion state, that we're not using this money, doesn't alter our taxes. We don't pay less federal taxes than someone in Kentucky or Arkansas where they are using the money. What it means is that we are not getting the benefits. So the question really is, how do we want to use our tax dollars? Do we want to continue to send them to Washington to be used in other states, or do we want to apply them to urgent needs here in our own state? And the economic benefits start with $1.4 billion a year in funding for jobs and for healthcare infrastructure and for coverage. But as I indicated earlier, it's also got a positive effect on the state budget. Jobs, the $15,000, the 15,000 jobs that economists at UTK project would be created by the additional money, and the 13,500 hospital jobs that are likely to be preserved with many more being preserved in other elements of the economy. Private insurance, I've already talked about the effect of not taking the money, increasing the rate of growth of premiums and cost-sharing requirements for people who are privately insured, and the increased pressure to restrict coverage and benefits for people with pre-existing conditions. We need to take this money. We have urgent needs to try to contain growing costs and growing pressures on those who have private insurance, either through the marketplace or through their employment. Its benefits flow throughout the healthcare system that all of us rely on. As I indicated earlier, there are large hospital systems that are doing quite well financially, but even those hospitals, for example, if you look at their obstetrical units, their neonatal intensive care units, those are heavily reliant on Medicaid funding and stand to benefit from an increase in Medicaid funding. There are other safety net facilities. This is not just a rural issue. Nashville General Hospital, for example, is one of a number of urban hospitals that provide a safety net for local residents. And the state's estimate is that Nashville General Hospital, which is under a lot of financial pressure, is losing $4.8 million a year because of the effect of the Durham law. That's $4.8 million that the hospital very much needs to update its equipment, to expand its staff to meet demand that it would get if we did away with Durham's law and accepted this money, kept this money at home. We all are aware of the addiction crisis and the toll it is taking on families and even on local economies, where it's difficult now. In some economies, we are told by economic development experts, it's been difficult to recruit industry in some places because there just aren't enough workers who are able to pass drug tests, and that affects everybody. None of us are untouched by the addiction crisis. None of us who live in rural areas are untouched by the effect of hospital closings and what that does to local communities. So really the healthcare effects of this are felt by everybody, either directly or indirectly. And then, of course, there's the 300,000 Tennesseans who are currently uninsured and who stand to get coverage if we take up this money and join the majority of other states, including Republican states, who are covering their working families. And let me take just a moment to explain who these folks are and how we got to a place where there are federal government subsidies for people with higher incomes, and there's Medicaid for some people, but there's no coverage at all for the people in the so-called coverage gap. Who are they? Well, the majority of them are in working families. They work in low-wage jobs where their employers do not provide insurance. 24,000 of them we know are veterans, and they cannot qualify for Medicaid, not because they aren't poor enough, they're poor enough, but to qualify for Medicaid or for TennCare, you have to fit into specific groups. You have to be a child, a pregnant woman, someone who is taking care of a small child or a minor child, or you have to be elderly or disabled. If you are just an ordinary working adult without minor children, you cannot qualify for Medicaid even if you have no income. You can be working two jobs, just not have enough income to be able to afford insurance, and you're not going to qualify for Medicaid. It doesn't make any difference how low your income is if you don't fit in one of those categories. As I indicated earlier, the Supreme Court ruled that it was optional for states to cover the people in the gap. What that meant was that when the Affordable Care Act, or Obamacare, was passed, the assumption was that Medicaid would do away with these categorical requirements. Anybody who was below poverty or close to poverty would be covered by Medicaid, and people above that would be covered through the marketplace if they couldn't get insurance through work, and there would be subsidies. Well, after states like Tennessee decided not to expand Medicaid, that created this strange situation in which people who were working and who didn't make enough to be able to afford coverage get no help whatsoever, whereas people above poverty, all the way up to 4 times the poverty level, which is $48,000 a year for an individual, can qualify for federal subsidies. So that was not the intention of the law, but as a result of the Supreme Court decision and the Durham's law in Tennessee, that created this gap. What does it mean to these people to not have coverage? Well, financial security is out the window. If you don't have health coverage, you are one not very serious injury, not very serious illness away from bankruptcy. We all know that. A single trip to the ER can destroy a family's dreams for its future, for the education of its kids, for financial security and retirement. Uninsured medical debt is the leading cause of personal bankruptcy in Tennessee. And we have seen reports from the bankruptcy courts that in expansion states, the rates of personal bankruptcy have dropped dramatically as a result of the expansion, the financial security. And of course, it's also obviously the health effects. People defer preventive care because they can't afford it. They put off tests for suspicious, possibly dangerous conditions because they worry that if they know that they have, for example, cancer, they won't be able to afford the treatment anyway, and they don't want to burden their families. And we've had doctors confirm over and over again that without insurance, people die sooner of preventable causes, and they have to endure pain and suffering and disability and impairment on their earning potential that they wouldn't have if they had insurance and could afford to get timely care. So the impact for these individuals is obviously enormous. And again, we keep coming back to rural, but I just want to make a point that we are talking about more than health care. When you lose a rural hospital, it makes it difficult or impossible to recruit new businesses to the area. You see the loss of what is usually either the first or second largest employer, second only to local school districts. These are jobs that in a hospital range from the CEO and the doctors to entry-level jobs doing custodial work. So these are great employers. They usually provide good benefits, including health coverage to their employees. Losing them has an enormous impact. And when you lose the ability to recruit new jobs, you lose your ability to keep young people at home and see an opportunity for a vibrant future. And when you start losing your young people who have to move away in search of economic opportunity, you see the withering of a valued, to Tennessee, really central to our identity way of life. So we're talking about the potential transformation of rural communities. There are hospitals that will have to transform. We need to come up with new models for some rural hospitals to keep them economically viable, but they've got to have financial revenues to make the transition to something more viable in the future. And expansion has been shown to reduce the threat of hospital closures in the 32 states in the District of Columbia that have expanded coverage. The rate of hospital closings is 6 times lower than it is in Tennessee and other states. And incidentally, the rate of rural hospital closings is higher in Tennessee than any other state in the country. We are second only to Texas in the absolute number, but Texas, of course, is many times larger than us. So when you adjust for the size of the state, our rate of closings is much higher. This is really a crisis, and there are at least 24 other hospitals out there across wide swaths of Tennessee that are at risk, and we could see transformations of entire areas of our state. So you've heard the case for why we need to keep the dollars at home. Now what? First, we need to make sure that everybody understands that holding out for a block grant is a non-starter. Others ask, well, we see that in other states such as Maine, voters have gotten together and bypassed their legislature to put a referendum on the ballot so that the majority of Tennesseans who support this have an opportunity to have their wishes implemented in public policy if the legislature won't do it. It's important to understand that's not an option in Tennessee. Our state constitution does not permit, as do many other states, voters to petition, and if they get enough names, to put a ballot issue before the voters in a referendum, which would then bind the legislature. We don't have that option. The only path forward is through the legislature. Only the legislature can repeal Durham's law. So where does that leave the rest of us who are not in the legislature and who care about our community and care about keeping our dollars at home? That means that we must educate the public about the practicalities of this. I indicated earlier, the polling shows that people want us to keep the dollars at home. They support Medicaid expansion. But what we need to do is do the education of what we need to do to get there and why this is so important in connecting to local concerns. So that's why there's the Bring It Home campaign. A number of and growing number of organizations, nonprofits are supporting this. The campaign is nonpartisan. We do not support particular candidates. We don't try to influence the outcome of elections. We are relentlessly local in our focus. This is a conversation that needs to occur within families, within neighborhoods, within communities, within legislative districts, where people come together, Democratic, Republican, old, young, black, white, wealthy, poor, it doesn't make any difference. This is an issue that should unite us all, and we need to come together and talk about it in terms not of an abstraction, but what does it mean in our local community that's grappling with the potential of a hospital closing or of having to raise local taxes to keep the hospital open. What does this mean in terms of addiction? What does this mean in terms of recruiting outside industry to our local industrial park that we've developed that we're having a hard time recruiting employers? We need to be intensely practical. This is not about philosophy. This is not about your ideology or your view of what government should do or shouldn't do. This is about, we have a lot of very practical problems that we need to address, and they will all be better addressed with $1.4 billion of keeping our own federal tax dollars at home to apply to those problems and their solution. So that's what the campaign is. What's the time frame? The time frame is, the goal is to achieve expansion next year in 2019 with legislative action when the General Assembly reconvenes in January. Because as I said, only the legislature can repeal Durham's law. So why are we launching this now? What's the big deal? Why are we talking about it now? And the answer regarding timing is that, as you undoubtedly know, we're in the middle of an election season. Half of all state Senate seats and all state representatives seats are up for re-election. Many of those are vacant because the incumbent is retired. So they're open seats. We have a governor's election. We have a U.S. Senate seat. Senator Corker's seat is open. So people are going to the polls in November. They're going to be voting in their party primaries in early August. They'll be making decisions about who's going to make these decisions about the future of healthcare and the economy in our state. As I indicated, we are not about trying to influence the outcome of those elections. We are not about trying to influence who gets elected and who doesn't. What we want to do is to make sure that everybody, candidates, voters, the public, everyone understands the importance of this issue so that regardless of who is elected, when the legislature comes into session next year, Everybody will have been educated. The public will be expecting, and elected officials will be prepared to bring the dollars home. So how do we influence that? So, as the saying goes, if you want to influence a politician, you have these conversations with the politician when they're running for re-election, because they're very anxious to hear from you then, and they want you to know their views. So our job is to, through the Bring It Home campaign, is to have these conversations now. Again, we are not trying to influence the outcome of the elections, but we do want everybody to understand this is an issue that we need to be talking about and that we need to be educated about. So the Bring It Home campaign will be involve educating our neighbors one-on-one, through our Sunday schools, through our civic groups, you name it, neighborhood organizations. We want everybody to understand this is an issue that affects all of us. It affects the state budget. It affects our state taxes. It affects what happens to our federal taxes. It affects what happens to our economy, and it affects what happens to our health care and our health care costs and rising premiums. That's a big educational task. We need to link this issue back to the concerns of ordinary Tennesseans. We need to be engaging our local organizations. Business groups need to understand this. They supported this 3 years ago. Now the time is ripe to support dealing with this issue. It's still with us. It's only gotten, our problems have only gotten worse. Bring It Home campaign is going to be hosting and working with local organizations to host community conversations. These are not political forums. We will not be hearing from candidates. These will be local leaders and outside experts coming to talk about this issue and how it ties back into the problems and the opportunities confronting local communities. We hope that everybody on this call will want to be involved. This is an extraordinarily exciting opportunity for us to have a say in how our tax dollars are being used. They're federal tax dollars, but the decisions about how they're used, whether they're put to use, are going to be made by the state, by the officials that we're electing this year. And we need to make sure that everybody understands the importance of this issue. If you think about the opportunity to influence, as a citizen, the expenditure of $1.4 billion on an issue that affects the most urgent issues, concerns facing Tennesseans, you'd be hard pressed to come up with another opportunity to have the impact that we will have as individual citizens and as groups that we belong to in the coming months. So this is really an exciting opportunity. We need to set the table now for success in 2019. If you want to become involved in this, and we hope you will, you can go to our webpage, which is on the screen, or you can email us at outreach@tnjustice.org. So we hope you'll be involved, and now I'm going to turn it back to you, Kyla.
Thanks so much, Gordon. We're now going to see if we open it up for questions. If you have any questions about what we talked about today or about how to get involved, we are happy to answer those. And if we don't have a chance to get to all of them, we can reply to everyone after this webinar with answers to those. So I see we have some questions that were typed into the question box. And so we'll go ahead and just start answering as many of those as we can in the next 4 minutes. And we will then send out the responses to the other ones in a follow-up email. So our first question is, how many Tennesseans are on Medicaid waiting lists? Last I heard, Nashville had 7,000 people on a waiting list for Medicaid.
The good news is there's no one on a waiting list for Medicaid or for TennCare. If you are eligible under current rules, and unfortunately the people in the coverage gap are not, you can sign up right away, and if you're eligible, you will be covered. There is a wait list for people with intellectual and developmental disabilities. It's actually not a wait list, but there are limited slots, and people have to wait, and people are taking off the list for special services, long-term services and supports. That's for people with severe disabilities that need a lot of home and community-based or nursing home type care. But that, if we're talking about regular insurance coverage, there is no wait list for Medicaid.
Great. Thanks so much, Gordon.
The next question
is, with the platform of balancing the federal budget, I'm assuming this is coming from a candidate. How do we reconcile expansion with the debt, the federal debt? This person is honestly interested in helping people, but the federal government is so far in debt that if we followed a strong, balanced budget plan federally, it would take several decades to pay it down, and not wanting that rug to be pulled out from under people who are in need either.
Great question. Thank you for asking it. Let me just say that I think all of us are concerned about the federal deficit, and it is something that's going to have to be reckoned with. Anytime you deal with budgets, you're dealing with priorities and choices that have to be made. I would just say at this point that although $1.4 billion is a lot of money when it goes out to Tennessee communities and Tennessee families, it doesn't have anything significant impact on the hundreds of billions, $1 trillion in national debt. Whether we take the money or not, whether we join the majority of states or not, will not have any effect on this. And our belief is that we should take maximum advantage of this resource for us while we can. If at some point Congress decides to become more responsible about balancing the books, that's a discussion that can take place then. But we have people right now that have cancer, that have other serious conditions, that are facing personal bankruptcy, and we have hospitals that are failing in rural areas. We need to take advantage of this. I would just say, in terms of the federal deficit, this is like highway construction funds or any of the other innumerable ways that the federal government spends money. I don't think we can and we shouldn't try to solve that problem without bringing all these other expenditures into the equation as well. We need to take advantage of this opportunity to help Tennesseans by using our tax dollars while we have that opportunity. Thank you for the question.
Great, thanks so much. So we had a couple other questions, most of which I feel like we did answer in the presentation, but we'll make sure to answer them in writing as well and send them out in the follow-up email so everyone has the responses to those questions. Thank you guys so much for asking these questions and for being engaged. We are really excited and honored to talk with you all and hope to get to talk to you more soon. Please do reach out. We would love to stay in touch. And we'll send out this PowerPoint and the recording after the webinar so that everyone will have access to it so you can look over it, and feel free to reach out if you have any other questions. We'll offer this exact same webinar again next Tuesday night from 6:30 to 7:30 in the evening. Central time. Good point, Gordon. Central time and 7:30 to 8:30 Eastern time. We would love, if you think anyone may be interested in that, to have them sign up for that webinar, and we'll include a link to sign up for that in the follow-up email as well in case you don't already have it. Please spread that around. We would love for everyone to have access to this information and hope that we'll have more people join us then. So without anything else, we'll go ahead and sign off, but thank you guys so much for joining us today.